I'm Loretta Simpson, CEO and founder of the Galilee Institute for Human Development. We are in a lovely place in West Africa known as the Republic of the Gambia. It's called the Smiling Coast of Africa. Today we are here at the Tujereng Health Facility. We're going to take a tour and show you around the facility and then talk about what some of the needs are. I want to introduce you to Commissioner Ansa Jawa. He is responsible for bringing me to Tujereng Village, and so we together and the community will figure out a way to bring more medical supplies and equipment so that we can support the facility. Commissioner Jawa, how are you today, sir?
I'm fine, ma'am.
Good, good. Thank you for bringing me to the health facility. So, as we tour today, what would be some of your primary goals and objectives?
Our primary goals and objective is that so that the community of Tujereng can have good health care, because a lot of women have challenges with regards to good health care, and especially pregnant women. They find it very difficult to get proper medication at the health center. So coming here will definitely add value for people to come forward and assist to General Health Center.
All right, so you've heard it for yourself from the commissioner. We are here today to make sure that we are highlighting some of the needs as well as the challenges and then the opportunities that you as a community can showcase your support in. I want to introduce you to Mr. Who?
Jaune.
Jawane. He is the head of this facility, an important person that just joined us. He is the Akalo's brother, as well as he sits on the council of the village here in Tujereng. I'm going to allow him to introduce himself, and then he can tell you how critical and important it is to have a healthy and functional and operational health center.
Thank you so much. My name is Karamo M. Bojang. I'm a council member who sits every Sunday to discuss problems in the village. And this clinic here, the hospital here, is one of our biggest problems. And we really need some assistance from anywhere. We need assistance because it's sponsored by the village itself. The government is doing very little on this hospital here. So we are doing almost 90% of everything. And this, we need people to assist us. We really need people to assist us to maintain this hospital. We have a lot of people living in this village, and healthcare is our main problem. Otherwise, we have to travel almost 40, 30 kilometers before we can get to the hospital, which is not safe for our patients, especially women on the pregnancy. We need quick service here, and we really need your assistance. Whosoever can, please, we plead to any of you, if you can help us, we really need your assistance. Thank you.
We've heard you say there are many people here in the village. Can you give us an estimate of how many people reside here in the village?
Yeah, now we have very close to 20,000. We have very close to 20,000 because 5 years ago it was around 15,000. And now migration, people are coming down these areas. And we have a social security village just close to Tujereng, where you have almost 1,000 compounds there, 1,000 compounds. Checking on that, at least each compound you have at least 5 people living in there. So you see, that is why I said very close to 20,000 people.
So are you saying in addition to Tujereng, are there any neighboring villages that also utilize this facility?
Yes, 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 yes. Because we have our catchment areas here, like a village called Batokunko. There's another village called Tanje, another village called Kendin Sebali, a village behind me calling Kunkujang, and the Banyakang. All these villages are depending on our health center here. So if we have to include all those people, we are talking of 35 to 40,000 people.
Yes. Again, I'm Loretta Simpson, CEO and founder of the Galilee Institute for Human Development. My motto has always been Africa for Africans. I think it is critically important for us to support one another, both here and abroad. So if you are Black and living in this African skin, it's important for you to step up to the plate and do what you can. We are one people. Regardless of where we are one people from one source, from one place. I say Africa for the Africans. And if you're listening to this message, if you can assist us, we're going to take a tour of the health clinic and you'll be able to see what the needs are. You also have an opportunity to meet the person who's heading this facility. So we don't want you to shy away from responsibility. We are responsible for cultivating and growing and supporting this village. So I want to thank you in advance, and we're waiting on the director to show up. And as he shows up, Commissioner Jawa, I know that you do a lot of support and work for the health clinic. Can you talk about some of the ways that you have supported this health clinic? And these are not obligations that he's done. He's committed himself to his village to support the people in this village. So he's not obligated to do this, but because he was born here and he loves Tujereng, this is what he does from his heart. Can you talk about what you do for this village?
I try to commit myself for the general development of the village, and by extension, a lot of people in this village, citizens of the Gambia, citizens of Tujereng, comes together to contribute and then support the health center. I can fully remember the Alcalo and the entire council decided to support the health center when definitely to get water was very difficult. And then not only the water, even the electricity and other contribution also to buy some medical materials, for the health center. They definitely come forward to assist the village for the health center. So definitely the community is very committed to make sure that let the health center be operating, and if you have the facility. So we also want to appeal to you and your people how you're going to help this community of Tujereng, the health center, because normally the supply which is sent by the government will not even take a week. The medicine will be completely finished. So the entire council, the Alcalo, and the youths and the entire people of the village comes together to see how they're going to assist the health center. So definitely, we also want to once again, on behalf of the Alcalo, on behalf of the council, on behalf of the entire people of Tujereng, that we want to thank you for your willingness to make sure that some of the challenges the community is having, so that it can be addressed as soon as possible. Thank you.
Tujereng, and I've been welcomed by the Akalo and the council. They are like my family, and when you support this village, you become united by one common cord, and that cord is family. We are here to support one another and to give assistance where assistance is needed. So that is my primary objective for being in the Gambia. And I've just been fortunate enough to be connected to a place that I'm passionate about. And I hope as we tour this facility, you will be passionate about Tujereng, the people of Tujereng, their culture, and particularly the health center. And I don't want you to get stuck on one specific situation, which is the health center. There are many, many needs in this village. So as we progress, we'll focus It's going to be a building block. We'll start with the health center. Then we'll look at other needs. We'll do capacity building. We'll look at infrastructure. We'll look at development. We'll look at other needs of the people in this village. So I want you to be open and stay open to the changes that are coming forth, and also to be a willing participant in this process, to be an expression of love, to show love and to give love to your very own people. So for that, I'm going to say thank you in advance, because I know when the call is made, you will hear the call and then you will come to assist. Introduce you to the director and the person that's responsible for ensuring health and safety at this facility.
Good afternoon, madam. I am Usman Jaune, the head of the facility, Tujereng Health Facility. I was posted here since 2017, October. The facility is was a small clinic, but as the population is increasing, the demand is getting higher. So looking at the facility, it's owned by the government, but almost 3/4 of the development is done by the community, and the community is here to empower the government effort. Government cannot do it all. Notwithstanding, we have series of activities that we render here in the clinic here, ranging from delivery of pregnant mothers, postnatal care, family planning services, referrals, dressing, reproductive clinics, and also counseling at some point. The facility is serving almost 26,000 people within the community here, ranging from Bayanyaka, Mariama Kunda, Bunkeling, Fala, Batukunku, and Tujereng itself, and Kentisebel. The facility per month, as I am speaking July, we nearly have about 24 deliveries, and the total consultation is about 1,408 people for the month of July alone. The other activities are not even counted. Family planning is not counted, dressing is not counted. Looking at the facility, we have series of constraints that we are trying to look help from people. Some of these problems are, one of the things is electricity. Electricity is a key thing that we sometimes have. You realize that we depend on the NAWEC. NAWEC is a company that is owned by the government, but at some point you realize that light sometimes goes off. So if we may able to find a solar power whereby we can have 24 electricity, that would be very helpful. You realize that at some instances, you can even see an asthmatic patient, whilst you're trying to nebulize, electricity goes off. Or somebody with critical condition like oxygen, light goes off. So if we can have that one, it would be very helpful. Drugs also is an issue. You realize that the drugs that we usually get from the government is very small. So you will also realize that you can even see a pregnant mother overnight, even a paracetamol, you cannot able to get it. So with that, we really need drugs. If we can have it from all kinds of, if we can get all support from any person who can able to help us from that. And you realize that even the community at some point will help us with some drugs. As I am speaking right now, the community gave us almost about $20,000 that we bought drugs. And this is what we are using. Looking at the facility also, you will realize that even the people who are coming for reproductive clinic here, the shed is very small and the chairs are not in good order. The shed sometimes leak when it rains. So if we may expand this thing to a bigger one, that would be very helpful. Ambulance service also is key. Um, we refer patients to bigger facilities like Banjul, Serakunda Hospital, Brikama. But you realize that the fuel that anytime the ambulance want to move, the patient or the patient's escorts need to buy the fuel. And you realize that at some instances, they will come here with nothing. At the end of the day, we either have to pocket it of ourselves or we call for help from the community. So this is a very critical issue. And looking at the ambulance maintenance also is done by the community. All the 2 ambulances that you see here is provided by the community. But when it gets spoiled, they maintenance it. But we realize that before they maintenance it, it's difficult. Sustainability is always difficult for us. So if we may also get help from people who can able to help to maintain, to make this maintenance for us and also the fueling, that would be very helpful because the facility is supporting all the needy people, the poor people that cannot able to afford some basic things for themselves.
Okay, I think let's just do a quick recap. I think what we've heard the director say is that he has critical needs. He has critical needs. He needs medicine. He needs supplies. He needs medical equipment for the health clinic, as well as electricity. He also needs a place to store the medicines, such as a refrigerator. So we're going to tour the hospital. There's a covering area where they take intake patients, and I think that's what he was referring to with the damaged seats. So he's going to take us on a tour, and you'll get to see the facility for yourself. So as we walk through, you can explain what we're looking at, and you can discuss the things that the ideas and visions that you have for the clinic, and then what you think the most critical needs are and what you need today. If you had an opportunity and you were granted some desires, what would that be like, and what would you want it to come in as?
Okay.
You said
Services,
waiting room.
waiting room, yeah, that they come here for their services, ranging from immunization, health educations, and other things. Yeah.
So can we take a good look at the waiting room that mothers come to for well care checks, baby checks, health care checks, and immunization?
Yeah.
So as you can see, the facilities, the benches are made of concrete. There's standing water here. You can see that there's an opportunity to make sure that this can be beautified, and then it looks like some of the structure needs to be remodeled and updated on some of the posters. So this is a critical needs area. And if you had your wish, what do you think it would take to repair this and bring this to a standard where patients would be happy to sit up under this awning?
If these things is well prepared, you realize that the convenience of the people who are coming for the service will be fine, and you realize that the ventilation will be okay. They will sit comfortably. There will be no leakage, and also the area seems very small. It's very small. I wish you come and see. The days like Tuesdays, you see the women that are coming for these services here. Yeah.
So I don't want you to shy away, from our requests and our needs. Now, people, look, when we're talking about pounds, dollars versus dolases, for every $1 US, it is 50 dolases. So if you contributed 1,200 US dollars. That would be around 62,500 dollars. Now, the reality of it is that's not a whole lot of money. So whether it's $100, $5, $10, $100, $500, $5,000, no money is too small. No gift is too small. No gift is too big. So when you think about it, for every one US dollar, it is 50 dollars. In that regard, how many dollars would it take to repair this structure?
I cannot imagine it, but I only know that the little that you do, you can save life. The little money you give, you can change life.
So, Councilman, what do you think our commissioner would it take to repair this structure? Is it concrete that's needed? A roof that's needed? What needs to happen to this space?
The concrete is needed, the roof is needed, and also the expansion of the seat is needed.
So, sometimes I ain't the smartest person on the block, but I ain't the dumbest either. So let's take a look at this. I'm going to give an estimate. My phone is off. I'm going to give an estimate. Anybody have their calculator on? If we take $80,000 for this particular structure, $80,000
80,000.
divided by 50, is how many US dollars?
1,600.
That's 1,600 US dollars that can repair this whole structure as a waiting room. Like I've just said, no gift is too small and no gift is too large, but collectively, together, we can make sure that the health center is getting what it needs. They have health and safety precautions to make sure that they are taking care of the community, women, and children. So that is 1,600 US dollars to repair this waiting room. So as we move forward, I want you to take us to all of the areas of the clinic.
Yes, this building, we want to use this building for accident and emergency unit. And this building needs some other infrastructure like toilets and also a bathroom. We also want to use it for observation, whereby when we see patient, we can observe you almost 6 hours, 12 hours, depending on your condition. So we want to use this one for that. So in this building, we need a lot of emergency equipment, and we also need some furniture. We also need some lockers so that we can equip this building. And we also need some filing cabinets and other things. And we also need some computers so that we can keep some information in it. Yes. The equipment, the furniture, and also a toilet and a shower so that when we observe patients here, they can be using their materials. Yeah.
Okay, so we've heard that this is going to be the emergency health post, where they come and do observations, they have testing here. So if you could take a look into this room, I'm going to get the camera guy to just give you a visualization of what this looks like. So there are certainly things that could be done that wouldn't take a lot of time, effort, or money to do. When you think about the people that are being serviced here, the amount of patients that are being seen, certainly this would make the administration components of the clinic to run more effectively and more smoothly. So the objective is to get those things that are needed and that would provide immediate relief and immediate assistance to the clinic as well as the patient. So if you could just come around and get a look at the facility, and there needs to be maybe a hospital bed so a patient can be checked out here. Is there anything else in addition to the bed you think that may be needed? I know you need toilet, you need seating facilities and waiting facilities. Is there anything else in this health post?
Yes, the furnitures, the emergency equipment, the oxygen, the cupboards whereby we can keep our.
Okay, so he needs furniture, oxygen equipment. He needs a place to store and to effectively maintain medicines that are going to be used for this particular facility. So cabinets with locks or without locks.
With locks.
Cabinets with locks to maintain medicine. So those are some of the things, and you may just get some cleaning supplies as well too, and sanitation needs for the patients that are here washing their hands to simplify this whole process. So we're going to another building. This is the first building that we have seen at the clinic, which is the emergency health post of this health center needs to be utilized. So to have one or two buildings that are vacant and not functioning properly creates an issue. So we need to bring these buildings up to a standard so that they are operating effectively. So this is another building. Tell us what this building is, please.
This building is maternity building. As at now, we are using this building for observation and also consultation. But if this building that is adjacent to this, opposite to this building, if this one is ready, we want to use this building purposely only for maternity cases, like pregnant mothers coming for their services, delivery, postnatal care. Looking at this building also, we need some help.
So this building is slated to be for maternal use only. Once this administration building is up to par, this will be for labor and delivery.
Exactly.
And we're fortunate to meet the only person that's delivering all of these babies by himself. So tell us about the building.
So the building, as we are we are using it for postnatal care delivery. At the moment, there is even one lady who delivered yesterday night, and we are also using the building for consultation, where patients are seated, for them to be seen by nurses. And also the other side, we use that one also for observation. With this building, we need a lot of materials here. We need some emergency equipment. As we know, maternal cases, you expect that you can have any emergency, like a postpartum hemorrhage. At the end of the day, you don't have oxygen. So we need oxygen here. We need some blood pressure machines. We need some BM machines, blood test kits.
I'm going to make sure we capture what you need. You said you need oxygen, you need blood pressure machines, and what else?
BM machines, blood sugar test kit.
Okay, blood glucose testing machines.
Exactly, we need some pregnancy test kits.
And pregnancy test kits.
Yeah, we also need some standard delivery beds. Delivery beds.
For delivery beds.
Yeah.
How many delivery beds would you say you need?
We need 4, or even more, 4 or more than that.
4 or more delivery beds.
Exactly. And we need ultrasound machine.
You've heard his need.
Yeah.
4 delivery beds.
Yeah.
And then an ultra machine. Most importantly, an ultra.
Exactly.
X-ray machine.
Yeah.
Ultrasound machine.
Ultrasound machine, yeah.
Ultrasound machine.
Yeah.
So delivery beds, ultrasound machines, oxygen.
Yes, these are some of the things we need. And we also need some standard admission beds, because the ones that we have here, they are not in good order.
So standard admission beds.
Yes.
And these beds are just patients waiting to see you for treatment while they're waiting?
We will going to, they're going to lie on it until at the time of their discharge.
Okay.
Yeah.
All right, so take us on a tour, please, of the maternity ward.
Yeah. So we need some contraceptives.
Are you ready?
On contraceptive, as you see it on the page here, for birth control.
Okay, so any form of contraceptive, whether it be pills, condoms, uterine devices, implants. So what is your preferred contraceptive for patients here in Tujereng?
In Tujereng, you can say we nearly see 20, 25 clients per month.
Is that you're giving the pill or condom?
We are giving all kind of contraceptives. Yeah, all kind of contraceptives. Even implant.
Wow.
Implant, condom, Depo-Provera, and pills.
Okay.
Yeah.
All right. So this is a basic need we need for prevention. These different types of contraceptives.
Yeah.
For privacy reasons, you won't get to see the entire labor ward. We had a lady who delivered just last night, so we want to make sure that we're being respectful and giving them their privacy. So you won't get to be able to see the entire labor department, but we're going to show you all the buildings and rooms that we can.
Yeah. So this is the delivery rooms. One of the delivery rooms are here. Is here.
This is a delivery room?
Yeah. So this delivery bed is it's okay. This is the standard delivery beds. We want these types of delivery beds.
So this is a standard delivery bed?
Yes. So
okay. Yeah. So these are the types of bed that you're seeking?
Exactly. Yeah.
Okay.
Yeah. At least if we can have 4 of these delivery beds, it's going to be very helpful. And we also need some. Yeah. We also need some Sonicare, fetal heart device.
Okay, let's go this way so you can see. So what is this called?
This is Sonicare fetal heart device that we use to hear the fetal heart of the baby. Okay. So we need these types of materials also.
It's called Sonicare.
Sonicare, yeah.
Sonicare.
Yeah.
Okay.
We also need some examination touchlights. Yeah, so we need some examination touchlights and even some delivery kits, some delivery materials.
Mm-hmm.
Yes.
What's in a delivery kit?
These are the forceps, the scissors, the speculums and other things. So we need these types of materials.
Okay.
Yeah.
So this is a typical delivery kit.
Yes.
You have forceps.
Yes.
You have
Speculum.
the gynecological, what you call it?
Speculum.
Speculum.
Yeah. These are some materials.
Okay.
Yeah.
So we need basic delivery kits.
And also vacuum.
And a vacuum.
Yes, we need these types of materials here.
Okay.
Yeah.
All right, so this is the labor and delivery room, and this is the type of bed we are seeking. We need 4 delivery beds.
Exactly.
Okay.
Yeah.
As well as fetal heart monitors, and we want to be able to hear and see how the baby and mom's doing.
Yes, and also the scales, baby
All
scales.
right,
Yeah.
we need baby scales.
Yeah.
So for every room, if there's 4 bedrooms or 4 delivery rooms, we need baby scales and delivery packets in every room.
Exactly, and also some dustbins.
And dustbins or
Dustbins, yeah.
trash bins, so we
Yeah.
need trash bins for every delivery room. What
Yeah.
about bedding? Do you use bedding here? No.
No, we don't use bedding, but we need some bed sheets.
Bed sheets.
Yeah.
We need bed sheets for the deliveries, for the beds.
Beds,
admission
exactly.
beds.
We also need some television screens. Sometimes when they deliver, or when they are even in labor, sometimes you can just see the television. That will ease some mild pain. Yeah.
Even if the television screen, what about, speakers for relaxation and meditation so that it can calm you down and help you relax your breathing. Anything to calm a mother down. Doing delivery. Delivery is like almost near death. So we need to make sure that the mother and the children are safe during this process. So
Exactly.
anything we can do to help.
Yeah. We also need a fridge here, whereby we can keep our vaccines, our drugs, so that they can be at a temperature whereby they might not be spoiled.
When you say a fridge, is
Fridge.
it like a regular fridge with the top and the bottom, or do you need a freezer for the whole part?
No, we don't need a freezer. A regular
Just the
fridge, yeah,
regular
exactly.
fridge.
Yeah.
So, I can say, what's the point of asking for medicine if medicine requires refrigeration and you have no fridge? So it's critically important that for the safety and well-being of patients, if medication requires refrigeration, that we have a fridge. So that's going to be like a critical need and one of the main focuses first that we should focus on.
Exactly.
Is trying to get this fridge in. And as we're progressing and development is happening here at the clinic, we'll make sure to keep you informed. You'll get to see where your dollars are going. You'll get to see growth. You'll get to see development. And definitely, you'll get to see the change in the health clinic. So I'll make sure that we're keeping you informed and keeping you abreast of what is happening in the clinic so that you can see where your money is going.
Exactly. And we also need some suction machines. Suction machines.
Suction machine.
Yes.
What is a suction machine? Is that it on the bottom?
Yeah, example like that one,
Yeah.
whereby, if a woman is in labor, sometimes like fitting or eclampsia, you realize that you can use some tubes to secrete some mucus that are in the mouth and in the nose.
Okay.
Yeah, that would save life.
So currently, do you have suction machines?
No, at the moment we don't have
All
more.
of the one suction machine you have is not operating.
Exactly.
So we need a suction machine. We're asking for your help, pleading for you to help get medical supplies, medical equipment, and medicine.
He doesn't want to use, sometimes he even try to use people to
And then another part is prevention. What do you do to teach people how to take care of themselves? Because there's a drug shortage. What can you do to change your health, your lifestyle, so that you're not having these types of health problems? How can you educate people on diet and food and drinking the right things? Okay, you ready?
Yeah, I'm ready, yeah.
All right.
Okay. This building that you are seeing here, we want to use this building for admission. When you admit them, you can say they stay for almost 2-3 days or 4 days. But with this building, there is no bed, there is no chair, there is no furniture, there is no cupboard. The building is built by the community. So anything that you feel we can use it for the admission procedures. So we need all those materials here.
Okay, so
Yeah.
this building is a shell of a building. It is a shell of a building. There's no furniture. There's no equipment. You need office furniture for admissions. You need proper toilets here. You'll need desks and furnitures and chairs. So just remember that this building is a shell, but we're going to give you a look. He said the community built this building, and how wonderful is that? But they need our help, and that's why we're here highlighting Tujereng Health Center to see what kind of help we can get in regards to helping them move this clinic further. So let's take a look at the facility.
At the moment, there is nothing there. It's just that we just keep it for temporal use, for storage purpose.
So currently, as I mentioned, this is just a shell. This is just the shell of a building. It is waiting on you. It was waiting on philanthropists like yourself, people who have the spirit and willingness to give and to help with advancement. So our primary objective here is to make sure the community in Tujereng has adequate health care and health care supplies. So that's the primary goal and objective, is to highlight the beautiful things that this community is doing, but also to talk about some of the challenges they have, and particularly in the area of health and human services.
Yeah. So yes, if the facility can be well equipped, it is going to be very helpful. We also do some other activities that help to promote and prevent their life system in regards to disease conditions. Days like Tuesdays, we give some health sensitizations on diarrheal cases, hypertension, diabetics, importance of hospital delivery, importance of prenatal care to get the pregnant cat. We also talk about the importance of immunization. We talk about nutritional support, some of the things that you can do to develop or improve your health system. Yes, these are also some of the things that we usually do. These like Tuesdays. Yeah. I also forgot to mention one thing also. The main building that we want to use for emergency care is, we have a small room attached to it. We want to use that one for laboratory facility. And laboratory materials are not adequate. We only have minor tests that we usually conduct here. So if we can have some hemocube that we can use to check the blood sugar, the hemoglobin, urinalysis, and other things, that would be very helpful. You realize at some point we refer patients only just to check their hemoglobin at a bigger facility. But suppose we have that one here, I guess we will not do that. Yeah.
Okay, so this was the first building that we showed you. That was the emergency building where all the office furniture and stuff is needed. There's a small room in the back. He said they want to convert to a laboratory room. And so, you can't have a lab without lab equipment and lab test equipment. So those are one of his critical needs. He talked about blood sugar, hemoglobin, different urine analysis, different tests that they can conduct on site without shipping a patient or transporting a patient miles away, when they can actually conduct laboratory tests here.
Lastly, staff motivation. Most of the government staff, that when you post them here, they don't feel like coming, simply because when they are in Brikama area or in Serakunda or in Banjul, they secure 2 jobs, whereby when you close, you go for another job. So at the end of the day, you have 2 salaries. But in places like this area, you're going to be only on 1 shift. Then when you close, you relax. So nowadays, to post people at remote areas is sometimes difficult. So to sustain staff, we need some staff motivation. Also, the community is also helping very well. Without the support of the community, our facility will not be clean. You will realize that some of the cleaners that we have here, are motivated by the staff. But you will be surprised that if I should tell you the little amount of money that they get from the community, you will say no. Less than 50 euros, $15 per month. Less than $50 per month.
50 US dollars a
Per
month.
month, yeah. So even the drivers also, we get support from the community. The community is also helping to give them a token. So if we can help maintain this, that would be very grateful, because at some point you will be calling them for referral overnight. They will be coming, but they are not happy because of the little money that they get. So staff motivation is key also.
Okay.
Yeah.
I want to make a public appeal. I am a proud member of Zeta Phi Beta Sorority Incorporated. We are one of 9 Black Greek organizations in universities all across the world. So I want to appeal to my Greek brothers and sisters. This is a special appeal to you. If you want to visit the Gambia, I'm going to make my house available for you and make other resources available for you. I'm asking all healthcare and medical professionals, if you want to visit the Gambia, instead of volunteering with the Peace Corps or Red Cross, you can do it right here at the Tujereng Health Clinic. I'm going to make sure that your accommodations are taken care of. I want to appeal to all the Divine Nine Greek organizations and healthcare providers. This is a special call to you. Gambia needs our help. Everything we do is about community service. It's about bringing development and opportunity. It's a service and servanthood. So we are here to be of service and to be servants to those who need our help. This is a special call and a special appeal to you, my brothers and sisters. He has just said there is a shortage of medical staff. I know plenty nurses and doctors in Greek organizations. I just spoke to one the other day who she is excited to come to Gambia. So, Dr. Charlotte, if you are out there and if you are watching this video, I want to make a special appeal to you. You are the president and head of Black Nurses Rock all across Texas. I want to make a special appeal to you and your organization, to all Black nurses, that you, as the head and president of Black Nurses Rock, make a commitment to share this video with all of your nurses and all the people in your organization. Let's get the momentum going here. Let's support Gambia. They are our family members and they need our help. So Dr. Williams, if you're here, don't forget to share this video with all Black Nurses Rock, all medical professionals. Are you shying away from Americans and the diasporans coming, medical providers to come and support and volunteer? Are you open for volunteerism?
I am hardly open. The door is open for all of them. The little that you can do, you can save life. The little that you can do, you can save life. You will be surprised that you come here one day, you say, you see a pregnant mother who need my service and need only paracetamol, it's not available. Yes, so the door is open for everybody.
Okay, so I'm really excited about this. I'm going to make myself available, my house available. I'm going to look for other accommodations. If you reach out to me and say you're interested, if we can start coordinating and planning, I have the commissioner here. I'm sure the commissioner and the Akalo of this village will be happy to accommodate you. We are family. We will make sure that you have everything you need, water, food, and you're good to go. You're ready to work, you're ready to rumble, you're ready to roll up your sleeves and do some work.
I'm just also trying to extend my appreciation of the demand from Loretta that to appeal to you people so that you can come and serve the community of Tujereng, the Gambia. I just want to strongly promise that if you come to the Gambia, it's a very peaceful country, and we are ready also to make sure that you can live comfortably in this great village called Tujereng. And myself, I am part of the state security of the Gambia. My profession, I'm an immigration officer. I am Commissioner of Immigration, the Gambia, and then actually on your arrival, we will even to be ready to facilitate that so that you can peacefully come to the Gambia and enter Gambia, and then you'll feel comfortable. We can assure you. Thank you.
Wait a minute. Did you people just hear that? That is epic. That is big. This is the Commissioner of Immigration, head of the North region. He said he's going to accommodate you and process your paperwork to make sure that you're able to come and serve and help in this village. That is epic. Thank you. Thank you, Commissioner. So we're excited, and I honestly want you to come to the Gambia. I came last year, fell in love with the Gambia, came back this year. Gambia is my home. So I have left the States and I have come home. And guess what they said to me? Welcome home. The commissioner and his family always welcoming me and feeding me. As a matter of fact, we're having a big lunch after this. I'm excited about this. So I want you to come to Gambia. I want you to experience this. Bring yourself and your willingness. Bring your passion, bring your purpose, bring your knowledge, your skills, and your ability. And most of all, come with a mindset of you are here to help. This environment is not about you. It's about the people that we are trying to serve and to help. It's about not the people, but our people. I believe there's an African word that says Ubuntu. I am because we are. So if I am African, guess what? We are African, and that's the call. You come to be an assistance to help make Africa great.
Thank you so much, Madam. Uh, I don't have more to say, just to express my appreciation, thanks and appreciation to you. I just want to use the best. The more you do, the greater it becomes. Thank you so much.
Yes, I am because we are. So we are here today not to highlight ourselves or to boast or be vain about ourselves, but we are here to make an appeal to you because we love this village and we love the people in this village. And the Akalo of the village has given us permission. And as we grow and develop, we'll keep being respectful and moving up the chain of command to make sure that all of our I's are dotted and our T's are crossed. We will make sure that every step of the way we are following protocol, and we will make sure that we keep you informed. Everything is total transparency and above board. So that is our appeal to you. Commissioner, I'll let Commissioner close us out.
Thank you very much, Loretta, Mr. Jowney, all other protocols duly observed. We are delighted once again and thank Loretta of taking this hard time to be with us since in the morning to make sure that we came here to visit and then identify some of the challenges so that how to overcome those challenges. We are also praying for you people, whether in United States or other countries in the world, and then we are praying so that wherever you are, so that you can have good health, have a very positive environment, and then may Allah also bless all of you because your minds are very clear that you have the intention to assist the people of the Gambia, especially the village of Tujereng. So we want to continue praying and then looking forward for your great assistance. Thank you.
That we say, Jarejef.
Aparaka.
Baraka.
Yeah.
Baraka as Mandinka. See,